Hello, my friends. This is Dr. Sharon with Clinic Reviews. Today, we're going to continue our walk through the Blue Book. The Blue Book, I'm pointing over my shoulder in case you can't tell what I'm doing. We're walking through the Blue Book. Mark Klimek wrote the Blue Book. It is a list of facts that you need to know. So we're going to cover croup today, only it's not called croup. In the Blue Book, it's called laryngeotracheobronchitis. So let's get started. Hello, Clinic Review family. I'm so glad to be back with you again. I hope everybody is doing great on all the tests they're taking. If you're getting ready to take the Nclex, you have found the right channel, y'all. We've got lots of videos that are going to help you. And we are also part of the Greater Clinic Review organization. This channel is geared towards helping you pass your Nclex or any standardized tests that you might be taking while you're in school. And Mark Klimek founded Clinic Reviews over 40 years ago, and he is mostly retired now. But we do have an online on-demand Nclex review that he teaches. It's over 21 hours of lecture content, and you also get the yellow book, and you get some questions and all kinds of stuff. So it's a comprehensive Nclex review. We don't cover the same things here on the channel that we cover in the actual Nclex review. ClinicReviews.com also offers a streaming service, and it offers, I forget the last thing, tutoring, small group tutoring. I teach 2 of those. Pete Savard teaches the other 2. We do next gen and everything. So we're going to be covering croup. It is in the Blue Book, only it's not called croup in the Blue Book. It's called laryngeotracheobronchitis, I think is what it's called. Larynx, trachea, and some upper respiratory bronchial stuff. So it's an infection of the upper airways, more common in children than in adults. And I teach you the content by going through questions. The Blue Book itself doesn't have any Nclex style questions. So let's go ahead and get started. A nurse is assessing a 2-year-old child who presents with a barking cough, low-grade fever, and inspiratory stridor. So stridor is, okay, that's what stridor sounds like. A barking cough, I think everybody knows what that is. So low-grade fever and inspiratory stridor. These findings are most indicative of which condition? Epiglottitis, bronchiolitis, croup, or pneumonia. So bronchiolitis and pneumonia would both be more lower respiratory. You probably wouldn't get the stridor with either one of those. You'd probably get some wheezing, some crackles with the pneumonia, probably some wheezing with the bronchiolitis. And I don't have any of those symptoms, so I'm going to cross off B and D. Now, epiglottitis, obviously, it's the epiglottis, it's upper respiratory, so sometimes croup and epiglottitis get confused a little bit. But epiglottitis is more of a medical emergency. You're more likely to see a closing airway with epiglottitis, has a lot of swelling associated with that, and epiglottitis is bacterial, so you see a high fever, much higher fever, rather than a low-grade fever, whereas croup is viral. So you see a low-grade fever. So these are the common symptoms associated with croup. If you don't know it, you need to know it. In comparing laryngeotracheobronchitis and epiglottitis, the nurse recognizes which key difference. Croup typically presents with a high fever, while epiglottitis presents with a low-grade fever. That's false. It's the opposite of that. B, croup causes drooling in most patients, while epiglottitis rarely does. That's actually the opposite. Epiglottitis is more likely when it can be a medical emergency, and epiglottitis, when they start to really swell up, they're going to drool because they can't even swallow their own saliva. C, croup and epiglottitis are identical. That's not true. Croup usually has a barking cough. That's true, whereas epiglottitis often does not. That's true. You don't see the barking cough with epiglottitis. So that is a key difference. Which virus is the most common cause of croup in children? Respiratory syncytial virus, parainfluenza virus, influenza A virus, or adenovirus. So it actually is the parainfluenza virus. It's actually an influenza bacteria that causes epiglottitis. So that's why they can be kind of easily confused. But parainfluenza virus is the virus that causes croup. The nurse is teaching parents of a child diagnosed with mild croup about home management. Which instruction is most appropriate to include? Have the child sleep in a supine position to maximize oxygenation, administer over-the-counter cough suppressants, avoid giving the child fluids overnight to rest the throat, provide a cool mist humidifier in the child's room. So supine is actually not the best way to lie. So lying flat actually increases coughing. So you actually want to raise their head up, put some pillows behind them. That's a better position. So A is false. B, administer over-the-counter cough suppressants. They don't recommend that actually because it can sort of block if it's getting worse, it can sort of hide that. So they actually don't recommend over-the-counter cough suppressants. Avoid giving fluids. That's not true. You want to actually keep things as loose as possible, keep people as hydrated as possible. So that's fine to give them fluids. And then cool mist is actually considered the number one treatment because it's viral. So we can't really give any antibiotics or anything like that. You want to keep them comfortable. And one of the things that can help them be more comfortable is cool mist humidifier. A child with croup is showing increased work of breathing and moderate stridor at rest. After assessment, the primary healthcare provider prescribes a corticosteroid. Why is this medication indicated? It primarily controls infection, it thins respiratory secretions, it reduces inflammation, it sedates the child in preventing coughing. So I hope everybody knows that steroids are anti-inflammatories. If you don't know that, you need to know steroids are anti-inflammatories. The nurse is evaluating a child who presents with a high fever, drooling, and refusal to lie flat. So that is all evidence of something serious going on. The child appears anxious, leaning forward with the chin thrust out, which diagnosis is most likely. So, y'all, they're not wheezing. Okay. So it's not lower respiratory, it's drooling. They can't swallow their own saliva. So their airway is getting blocked off. They're not lying flat because that's hard to breathe when you're lying flat. And they're leaning forward with their chin out. They're trying to open up their airway. So that is epiglottitis. A hospital child with moderate croup is receiving a racemic epinephrine nebulizer treatment. Which statement by the nurse best explains the reason for this treatment? It will shrink the swollen tissues in the airway, easing breathing. It will paralyze the muscles of the airway, stopping the cough reflex. Yikes, that doesn't sound good. It will destroy any bacteria causing the infection. Well, that can't be true because croup is viral. It will prevent the development of pneumonia. I know B and C are not true. So racemic, I did actually have to look up the word racemic. Racemic just means it has two different types of epinephrine in it. So epinephrine, what does that do? Well, epinephrine is a sympathomimetic. Epinephrine is one of the neurotransmitters in the sympathetic nervous system. The sympathetic nervous system is fight or flight. So fight or flight, it opens up airways. It can reduce some swelling. So epinephrine, if you give epinephrine as a nebulizer, it actually is going to decrease the swelling of tissues. It doesn't prevent the development of pneumonia. It actually decreases swollen tissues and eases breathing. Which action by the nurse is most appropriate when assessing a child with suspected epiglottitis instead of croup? Place a tongue depressor in the child's mouth to visualize the throat, arrange for immediate intubation, equipment to be at the bedside, encourage the child to swallow oral fluids to check gag reflex, have the child blow into a peak flow meter. So you have to know that epiglottitis is considered a medical emergency. Their airway is closing off. You definitely don't want to put a tongue depressor in their mouth. That can cause it more swelling or it can block off the airway completely. They can't swallow. They're going to be drooling and there's no point in blowing into a peak flow meter. So intubation is a high probability for someone who has epiglottitis. A 4-year-old child with croup is restless, has nasal flaring, and is using accessory muscles to breathe. The pulse oximeter shows 93%, which is the low end of normal. Which nursing action takes priority? So they're not hypoxic yet. They have croup. So it's not a respiratory emergency, but they are experiencing and demonstrating signs of distress. Okay. So we've got croup with some distress and some extra work of breathing, but they're not hypoxic yet, although they are the low end of normal. Provide 100% oxygen. Well, 93 is the low end of normal. So maybe notify the healthcare provider and prepare for intubation. Well, not yet. They're not in respiratory failure yet. If their SpO2 was like 84%, maybe, but actually we're looking for a priority action. So I would do oxygen before I prepare for intubation. Sit the child upright. That's good because it helps the work of breathing and encourage slow, deep breaths. So they're using accessory muscles and nasal flaring. So that seems good. Administer a dose of IV antibiotics. That's not going to help. It's viral. So I mean, A and B sort of sound good if you don't understand there's a difference between croup and epiglottitis. A and B would be more epiglottitis, whereas C is best really for croup. A child with croup is anxious and crying. The nurse knows that crying can worsen the child's respiratory status. That is true. Which nursing intervention would be most effective in preventing further respiratory compromise? So, anxious and crying, we don't want them to cry. Use a calm, soothing approach and allow the parent to comfort the child. Well, that seems good. Request a sedative. So, we don't give sedatives to babies with croup. It's contraindicated because it can hide or mask worsening of the problem. Explain to the parents that crying is normal. Leave the child rest. No, because we don't want them to cry. It exacerbates their respiratory problems. Place the child in a supine position to conserve energy. No, we're going to just the common sense answer here, folks. In reviewing the plan of care for a child admitted with croup, the nurse expects to see orders for which medications. Select all that apply. Corticosteroids like dexamethasone, prednisone, dexamethasone, those are corticosteroids. Antibiotics, that's no, because croup is a viral problem. Racemic epinephrine, I like that one. Bronchodilators, oxygen therapy is needed. Oxygen therapy as needed is always fine. So I definitely like C and E, definitely. Now, are we going to give corticosteroids? If they're being hospitalized, I guess even if they go home, they could do oral steroids. I mean, it is a swelling, right? That's why they have stridor, because they have swelling. And so, yeah, I mean, corticosteroids could certainly help. Antibiotics would not help at all. Racemic epinephrine, that's fine because that decreases swelling. Bronchodilators actually is no, because bronchodilators is for lower respiratory problems like bronchitis or pneumonia. This is an upper respiratory problem. That's why we're doing epinephrine nebulization rather than a bronchodilator. So A, C, and E are the correct answers here. A nurse is caring for an infant who is at high risk for airway compromise due to croup. Which assessment finding would indicate the earliest sign of hypoxia? Bradycardia, lethargy, anxiety and restlessness, cyanosis of the lips. So I like this question because this is true whether it's kids or adults. Y'all, the earliest sign of hypoxia is anxiety and restlessness. That is by far absolutely the earliest sign. Once the body kind of is able to respond to hypoxia, they're going to increase respiratory rate. It's going to increase heart rate, trying to get more oxygen to the tissues. So those are early signs as well, but anxiety and restlessness are the earliest signs. By the time you get to A, B, and D, this baby is extremely hypoxic. When educating parents about the potential complications of croup, the nurse should emphasize the need to watch for frequent sneezing and nasal discharge, high-pitched stridor at rest, mild abdominal pain, productive coughing of green sputum. All right, when educating parents about the potential complications. So I don't think sneezing and nasal discharge is a complication of croup. High-pitched stridor at rest. So high-pitched stridor, so normally stridor is lower pitch, like that. Okay, that's some airway narrowing, but not serious. If you get to, you got a really narrowed airway, y'all. High pitched stridor is much worse than lower pitched stridor. So a B is not a good thing. Mild abdominal pain, that's not really a complication of croup. Productive coughing of green sputum. I mean, I guess it could move into a pneumonia, but I don't think pneumonia is a common complication of croup. You're much more likely to experience a narrowed airway than you are to move into a pneumonia. So I would say high-pitched stridor. A 3-year-old child is being discharged after hospitalization for croup. Which statement by the parent indicates understanding of discharge teaching? He should sleep flat on his back to prevent coughing. I hope by now everybody knows don't do sleeping flat when they're croup. I'll give them the antibiotic until the barky cough goes away. I hope everybody knows not to do an antibiotic with croup. I'll cancel his flu shot next week because croup is caused by viruses. Croup is caused by viruses, but you can still get the flu shot. I can use a steamy bathroom or cool mist if he starts barking at night again. So actually, that's true. So cool mist or steam, cool mist. So mist is the air, or is the fluid in the air, right? So that like loosens things up. And then steam, honestly, I don't know what steam does. That probably loosens it up too. So steam and cool mist are considered both appropriate. So which statement by the parent indicates understanding? So I want the right answer. So D is the only right answer. Everything else is not right. Okay, I think that covered just about everything that was in the blue book. If you've studied the blue book before you did this, then I hope you got everything right. And if you haven't studied the blue book, then maybe you need to go back and study Croup, okay? Thanks for being a part of the Clinic Review family. Have a great rest of your day.